I'm Dr. Tom Barrett. I'm an orthopaedic surgeon in George. My area of interest and the area that I focus on and the area that I'm most interested in is joint replacement, specifically the large joints, so hips, knees and shoulders. I was quite interested in starting up with computer-assisted surgery, which basically helps with alignment. You use a three-dimensional camera. And then it was in 2023 that I moved from computer-assisted to robotic surgery using the CORI system. Most of the knees I was using then was the Journey prosthesis, or the Journey 2 prosthesis from Smith & Nephew. And then I started hearing about the medial pivot knee. I've been hearing about very good outcomes, early mobility, patient satisfaction, improved outcomes, and that's what made me start investigating. And I think maybe the situation where I was able to go and join Dr. Fenter in theatre, that was a very big, important step for me to see, because I know Dr. Fenter and he's a well-respected doctor, and I don't think he's easily somebody that would change his mind relating to a prosthesis unless he was very assured that he's moving to a product that is better and maybe the best that he's been able to use. So that was I think the turning point where I decided that I should be following the path of the medial pivot knee, and since we've been now using that knee since November, I think, last year, 2024, and I've been using it full time since then. I like the design philosophy. I've always been a proponent of measuring and resecting what you've taken out that you put back in. So a medial pivot knee, and that's my experience just for the short time I've been using it. The idea is that, especially if you're using kinematic alignment, you're taking out the bone, you're measuring, and as you resect the bone, the prosthesis is meant to be fitting exactly into that space. You accept the patient's natural alignment in many cases much more than you would otherwise. And in so many respects, you have to make fewer changes. You don't have to release ligaments. You don't have to be altering your cuts to try and make sure the prosthesis fits. Everything is fitted as it is taken out. And I must say, from the perspective of just seeing how things have changed with my practice and starting with the knee, I feel it's been quite significant. It does benefit you in all those respects. And I think it's because you're respecting the patient's anatomy. So what you're taking out, you're putting back in. The design of the prosthesis is that there should be very much an even movement between flexion and extension. But my general impression is that the patients regain their flexion with the greatest of ease. That's something that's remarkable, it's noticeable, and it's different to what I'm normally experiencing. And the confidence to be able to get up and walk, and in general patient satisfaction, I think, is better. Feeling that they're able to move their knee in a very natural way. They're able to bend their knee more easily. They feel stable and comfortable and confident about mobilizing. The patients have come back with a more positive outcome. Yes, the stability is very good. We need the knee to be both stable while it's in flexion and in extension, and that requires obviously excellent stability in both positions. The patient is, without having to think about it, making use of the stability, and it seems to be vastly improved. Have a look at the data that seems to be coming through at the moment. Speak to some of the surgeons that are using the system, and you might notice that a lot of those surgeons, especially if you're talking about surgeons around South Africa, a lot of them are the well-respected. I would think that if you've got the type of doctor that's happy to move over to a different system based on outcomes and is expecting and getting the outcomes that they are hoping for using the system, that would definitely be worthwhile considering. So have a look, and then I would say they should at least do a few cases and see what happens with their own practice. I think that's important.